Right, welcome back. We've got Maddie again. So last video we went through freeing up that upper cervical restriction that she had. Now we're going to go through and free up the rotational restrictions that she has. So even though we did get a really good change, it's really important to note that we've got other muscles here that we need to target to really get a really good long-lasting change. So just let's recap with Maddie, is that she obviously had some restriction going around into that rotation. Okay, it was up on the left-hand side here, okay, going around to the right, and obviously up in this area here as well. So these are the areas we're going to target. We're going to obviously offload, but we're going to challenge this SCM in some of these passive release techniques that we do. All right, so come join me. Come and lie on your back for us. Okay, so what's really important with this release technique is that they're nice and relaxed through their head, so they're not holding any tension through there. Once again, we're going to use the Pre-Max cream because we're targeting a specific area as opposed to the lotion of a region. So we don't need much. So in order to engage this SCM, we need it to be nice and relaxed and not under tension, okay? And the idea is with this technique, once again, we're going to challenge that range of movement. So if we bring the head into a little bit of lateral flexion, that will shorten off that SCM, so it'll allow us to pick it up. And we want to sort of pick it up in a pincer grip if we can. And what we're going to do, it's going to be a two-part process here. We're going to release the bottom part, okay? So the lower half of the SCM, and then we're going to come up and we're going to do the upper half, all right? So a little bit of lateral flexion. Make sure Maddie's nice and relaxed. Just relax. Yeah. Now, if they have a problem with relaxing, just get them to push down on their hand, their head onto your hand. Okay, you just do that for us. And relax. Okay, usually that'll just take out any of that hypertension that they're just holding on or guarding. All right, so we're going to pick up that tissue, okay, in a pincer grip. What we're going to do is we're going to bring her into a little bit of rotation towards the SCM, and then what we're going to do is we're going to glide along and then take her into rotation away, okay? So picking up, gliding along, and then into rotation, okay? So we're only doing the lower half here. Okay. Now you might find your clients, if they're really quite tight through this area, you'll have trouble picking up the SCM. If that's the case, then you're just going to have to use a gliding technique. But honestly, picking up the SCM in a pincer grip is always going to be the most preferred way to do that. Okay. Now there is a bit of an art to this technique, because if you press too hard, the muscle will just slip underneath your fingers, and obviously that will be really uncomfortable. So let's not do that. Okay, so we get about 5 or 6 really good sweeps through there. And remember, it's all about challenging that range of movement, okay? That's great, Maddie. Right, now the second part of this is we're going to work the upper half of the SCM. So this time what we're going to do, same scenario, lateral flexion, little bit of flexion, okay? We're going to pick up the upper half, okay, in a pincer grip again, and then what we're going to do is we're going to lift the back edge of the SCM up and off the posterior, okay, like so. That's good, Maddie. So once again, we're challenging the upper half of that SCM. Great. Now these techniques, they're fantastic. And it's not a technique that you need to do for 5 minutes. This is something that you just need to do for about 1 or 2 minutes, and you go from there. Okay, so just lifting that up, challenge that tissue as much as you can until you feel like you get that release technique. Okay, terrific. All right, now let's get Maddie up, have a look at that range of movement, go from there. All right. Okay, so let's get you to go around to your left for us. How's that feeling now, Maddie?
Much better.
Yeah, that's good. All right, and then around to the right. Yeah, terrific. Does that restriction sort of drop away through there now? Yeah. Much free to work through. Okay, fantastic. All right, so that's a really, really effective tool. So remember, upper cervical SCM. The next video we're going to look at trying to free up a little bit of that lateral flexion, and we'll look at that scalenes muscles. If you like